very much to Inclusion Ireland for inviting me here today. I'm very happy to talk about some of the different research projects we've done on the area of disability and social inclusion. And I'm trying to find the forward arrow here. I think if I hit enter. Very good. Okay. So very briefly, we know that people with a disability have a higher risk of poverty and social exclusion. If we look at income poverty and deprivation, we know that the risks are higher for people with a disability. One of the main reasons for this is their lower levels of participation in the labour market, their lower employment levels, which has a big impact on their income and their access to resources. So I'm going to examine basically looking at some statistics from before the recession and during the recession, looking at the labour market situation of people with a disability, their experience of discrimination, because discrimination obviously has an impact on their well-being and on their social inclusion, income poverty and deprivation levels. And I'll define all of these a little bit as I go through the presentation. And I'll be drawing on a number of different national surveys with very large samples, including the quarterly National Household Survey Equality modules from 2004 and 2010, the survey on income and living conditions, the SILK surveys from 2007, right before the recession, and 2011. How is disability measured in the QNHS Equality module? It basically asks whether the person has any of the following long-lasting conditions: a sensory disability, physical disability, intellectual or learning disability, psychological or emotional condition, or other type of condition that affects their ability to participate in social life and employment. There were some differences in the wording of the question used to assess disability between 2004 and 2010, but the checks we did suggested that the overall percentage of people with a disability was not dramatically affected. There was some movement of people between categories. For instance, pain was first mentioned in 2010, but wasn't specifically mentioned in 2004. So people who in 2004 might have said that they had a physical disability would have put themselves under the other category, which is where pain was included in 2010. But the overall prevalence was quite similar. When we talk about labour market disadvantage, we're looking at things like being outside the labour market. That means being what's called in economic terms inactive in labour market terms. The person is not in employment and they're not seeking employment. And the other type of disadvantage we look at is being unemployed. So of those who are in the labour market, who are either in employment or seeking employment, what proportion are unemployed? They would like to work, they're seeking work, but they're not able to work. So I'm going to show in the following slides the overall rates of being outside the labour market and of unemployment, and also what we call the model estimated rates. That's the rate we would expect if people with a disability and people without a disability were similar in other respects, and those other respects include things like their nationality, what part of the country they live in, their marital and family status, and their level of education. So the model estimated results basically ask, how big is the gap if we could sort of take away all of the other ways in which people with a disability differ from people without a disability? So looking at the overall results, first of all, and showing people outside the labour market and the unemployment rate, the percentages for people with no disability. And you can see that the percentages outside the labour market were 22 in 2004, moving to 23 in 2010. So there was a very, very small increase in people moving outside the labour market as the recession hit, perhaps as a result of early retirements. This is people with no disability. The unemployment rate increased very dramatically from 5% to 16%. What happened to people with a disability in the same period? you see that there was, again, a very small change in the percentage of people in the labour market. In fact, it looks like there might have been a tiny improvement. People with a disability were perhaps more likely to stay in the labour market than to move outside it. But their unemployment rate also increased very dramatically. The other thing to notice in the chart, of course, is that the percentage of people with a disability outside the labour market is much higher. You know, roughly 2/3 in 2004, falling slightly in 2010. And the unemployment rate is also considerably higher, 8% in 2004, 22% in 2010. So in terms of these indicators of labour market disadvantage, people with a disability are in a worse position than people without a disability. You know, we might have expected that, but these figures show how big the gap is. What about when we control for other characteristics? And in the research we did on this, we found that when you look at what happened over time from 2004 to 2010, there was a slightly different pattern for men and women with a disability. So we're looking here at working age people with a disability. I'm going to show you the figures for men and women separately. They're the model estimated rates, so we're holding constant other characteristics. We're saying, what if men and women had the same age range? What if they had the same levels of education, marital, family status, housing, and lived in the same regions? What would we find in terms of labour market participation and unemployment? Looking at men with a disability, first of all, comparing 2004 and 2007, 56% were outside the labour market in 2004. That dropped down to 49%. So that marker of disadvantage showed some improvement for men with a disability. On the other hand, just as happened with the general population, there was a very sharp increase in their unemployment rate from 4% to 18%. So very badly affected by the recession in terms of unemployment, although there does seem to be an improvement in orientation to work. What happened with women with a disability? You don't see that improvement in terms of orientation to work. 57% were outside the labour market in 2004, pretty much the same percentage as for men. Going to 60% in 2010. Because the sample size isn't very large, we can't be sure that that was actually an increase, but we can be sure that there was a reduction or an improvement in the situation for men when it comes to being outside the labour market. Looking at unemployment, tends to be lower for women with a disability. That's true also for women without a disability, but it did increase very dramatically over the period as well. So the gender difference suggests that there was an improvement in labour market participation for men with a disability between 2004 and 2010. Might be surprising given the recession. It didn't help them in terms of unemployment, but it did sort of increase the labour market orientation. And 2004, 2005 was a period when you began to have a lot more attention paid to the issue of disability in national policy with the National Disability Act, the National Disability Strategy, several different legal provisions looking at equal treatment of people with a disability. So it does seem to have had an effect in that regard. Turning then very quickly, just to summarise, I don't need to spend time on this because I've just said it. Turning quickly to discrimination. Again, we're using the same source of data, 2004 and 2010, the equality module, and the measure of discrimination is based on asking the person whether they were discriminated against in a specific social context. So we're looking at work situations, at various access to different types of services. And we're asking them about what happened in the last 2 years. And also the person is given a definition of discrimination. So discrimination in Irish law is unfair treatment based on one of the 9 equality grounds. And I'm not going to try to say them all because I'm bound to forget a few. But there are things like gender, disability, being a member of the traveller community, ethnicity, religion, marital status, and sexual orientation. I know I've missed one. You can shoot me afterwards. In terms of the type of discrimination, what I'm going to show you is the difference in experience of work-related discrimination. That would be a person who feels that they were discriminated against in the workplace, perhaps related to promotion opportunities, or while seeking work in relation to being offered a job or seeking work. And then service-related discrimination is where the person reports discrimination in the past 2 years in trying to access different services. They could be shops, pubs or restaurants, financial services, education, housing, health, transport, or other public services. So looking first of all at changes in discrimination between 2004 and 2010 for people with a disability compared to people without a disability. If you look at people without a disability, first of all, 7 to 8% experienced work-related and the same proportion experienced service-related. Not much change really over the time. There was a little bit of an increase in work-related and a little bit of a reduction in service-related discrimination. What happened to people with a disability in the same period? Very dramatic improvement. If you look at work-related discrimination, it went from 16%. So in 2004, people with a disability were reporting a much, much higher rate of work-related discrimination. By 2010, that had dropped to 10%, so that the difference is not statistically significant between people with and without a disability in terms of work-related discrimination. So that shows a big sign of improvement in that regard. In terms of service-related discrimination, you see an improvement, but you still see at the end of the period a big gap between people with and people without a disability. In 2004, 21% of people with a disability reported discrimination in accessing services. That had fallen to 15% by 2010. When we look at people with a disability within the group of people with a disability, just to give you a flavour of some of the differences we found there were some groups of people with a disability who were more likely to report discrimination. These included lone parents with a disability, reporting higher levels of work-related discrimination, younger adults with a disability. People with learning or intellectual disabilities were more likely to report work-related discrimination. Those living in the Dublin region, people who were renting accommodation privately, service-related discrimination, and people who were members of minority religions or no religion, they were more likely to report service-related discrimination. What I'd like to do now is turn very briefly, I don't want to come between you and your coffee, it's a dangerous place to be. I'm going to turn very briefly to indicators of poverty and deprivation. We're turning to a different survey now, and the measure of disability is whether the person, an adult, age 16 or over, is limited in their daily activities due to a health problem, and whether that limitation is a little or severe. When we talk about the indicator of poverty, we're talking about the household as a whole having disposable income, that's income after tax and PRSI, less than 60% of the median or the middle level of income across households after adjusting for differences in household size and composition. So when we say adjusting for need, the only need that we adjust for in the national poverty measure and the poverty measurement generally is the number of adults and children in the household. We don't take account of things like disability, but as John's talk earlier suggested, that is something that definitely ought to be on the policy agenda. So just as a for instance, the poverty threshold, or the line below which a household will be considered to be poor, depends on household size and composition. For example, in 2012, it would have been below 204 for a person living alone. That's take-home pay or disposable income, and below 473 per week for 2 adults and 2 children. That just gives you an idea of the level of income we're talking about. I'm going to focus on model estimated results here. So when I'm looking at people with a disability and other adults, I'm going to be showing the estimated rates or the expected rate of poverty if the only difference between the two groups was in terms of their disability. if we were to hold constant whether they're male or female, their age group, family status, nationality, level of education, region, and whether they lived in an urban or rural area. So looking at the poverty rate, first of all, for 2007 and 2011, looking at people with no disability, the poverty rate increased from 14% to 17%. Not terribly surprising, there was a recession on. More and more people were losing jobs and having reductions in income. Oh, what goes on here? In the same period, you actually had an improvement. This is purely income-based poverty in the income-based poverty rate of people with a disability. It went from 23% to 17%. How is that possible? It's paradox. How could you have a falling poverty rate when there's a recession on? Well, the reason for it is that we're just looking at income poverty here now. We're not looking at standards of living. People with a disability, as we saw from the earlier slide, are much more likely to be depending on social welfare because they're much less likely to be at work. So what happened in the early recession years and from 2004 onwards was that you had an increase in social welfare rates. What I'm going to show you now is what happened to the rates per recipient of social welfare, holding prices constant, showing them in 2011 prices, and I'm going to show it as an index. And I'm also going to show you what happened at the poverty line in the period as an index. And when I say I'm showing it as an index, I'm setting the 2004 value to 100 and just showing you the rising and falling of both of these. So when you look at the social welfare rates, and again, taking a 3-year moving average to get rid of some of the ups and downs of the line, you see that the rates tended to increase up until 2008, 2009, and then started to fall as they started to be cut. So early in the recession, the rates were still increasing. What happened to the poverty threshold? The poverty threshold, or the poverty line, depends on all incomes, including incomes from work, and most incomes are from work. So the poverty line was increasing as standards of living and incomes generally were increasing up until the recession began, and then it started to fall. So that explains the paradox. Social welfare rates were increasing very rapidly, more rapidly than the poverty threshold, up towards the beginning and into the early recession. Then they started to fall, but they fell at a slower rate than the poverty line. So incomes, very paradoxically, for people who were dependent on social welfare, remained above the poverty threshold into the recession. Now you might well ask, what does this mean? And you may know that in Irish national policy, we don't rely on a measure of income poverty. We also take account of what we call material deprivation. That means it's a standard of living measure, basically, based on the household being able to afford basic goods and services. What happened to the standard of living of households in the same period? And deprivation then is based on lacking 2 or more of 11 very basic goods and services because the household cannot afford them. Things like food, clothing, adequate heating, being able to replace worn out furniture, being able to buy presents for family or friends once a year, and being able to participate in social activities. So very basic things that most people would want to do, but some people cannot do them because they cannot afford to do them. So now again, we're going to look at the model estimated results for 2007 and 2011 for people with no disability and for people with a disability. For people with no disability, the rate increased. Okay, we saw that the poverty line, the poverty rate increased. The disability rate also increased very, very sharply between 2007 and 11 for people with no disability. And it also increased, the basic deprivation rate also increased for people with a disability. So basically what was happening with income poverty was a little bit of an anomaly due to the fact that you had such a dramatic fall in incomes with the recession. Things appeared to be getting better for people with a disability, but when you look at their actual standard of living, things are not getting better. Okay, you can see that their situation is disimproving, going from 24% in 2007 to 36% in 2011, and remaining well above the level for people without a disability. So at the start of the recession, this is just repeating what I said, the poverty line dropped because of falling wage incomes. In the early recession, people depending on social transfer incomes were relatively protected, and that included people with a disability, but basic deprivation rates increased. So the more direct measure of their standard of living, if you like, showed a disimprovement. To wrap up then, labour market disadvantage persists for people with a disability in 2011, being outside the labour market and unemployment are higher. The disability gap, if you like, that's the gap between people with and without a disability. It narrowed for men in terms of the percentage outside the labour market, but it didn't change very much for women. Discrimination fell substantially for people with a disability, but service-related discrimination is still higher for people with a disability than for people without a disability. These kinds of improvements over the period, you know, it's very difficult to pinpoint exactly what might have been happening, but there was a lot of policy attention to the civil rights of people with a disability, a lot of policy attention to equality issues. It's possible that that was part of what made a difference. Question mark, because it's always very hard. Other things were changing as well at the time. The poverty rate fell for people with a disability, closing the gap between people with and without a disability. But as I said, that was a little bit of an anomaly due to what was happening with the recession. But the deprivation rate increased and remained substantially higher for people with a disability. And there's evidence here when you see the very high rates of deprivation for people with a disability that the incomes are not adequate to meet the needs of people with a disability. So that's it. Thank you very much for your attention.